Well, hello, everybody out there. This is our Start or Sit podcast. I'm Shannon O'Kelley. I'm a physical therapist, and Dr. Hawkins joins us. He's an orthopedic surgeon specializing in sports medicine. We've been doing a Start or Sit podcast for you NFL players out there, fantasy football players, and this is week 13, and we're going to get started here. This is a big one. This is a huge one. Mr. Aaron Rodgers, Green Bay Packers. Understand he has a toe fracture. I think he's been trying to play through it, but there's talk about maybe having to repair. Let's talk about that, Dr. Hawkins.
Yeah, it's a bit of an unusual injury. I know there's been some speculation as far as how it actually happened, but it sounds like he's got a fracture of one of the phalanges, so the small bones that are near the tip of the toe, and it's involving the small toe. So, generally that's an injury 99.9% of the time. You're going to kind of leave it alone and not do anything with it. But obviously he's playing and he's putting a lot of stress on his foot. And I think the concern is if this thing displaces or moves, it may in some respects compromise sort of his function, his ability to do things in the future. So I think that's where the debate is coming out. So he has played. They've given him a shot before the last game to essentially numb up the toe, and that's how he was able to play. But I think what they're doing is they're looking at it with an x-ray probably each week and sort of seeing what things look like. And he's hinting at the fact that maybe he's going to undergo a procedure, which probably involves putting a pin in to hold the bones in place and still play after that. So he's kind of dancing around a little bit on this. So I think he's going to be playing regardless of what he decides to do. But I think he's kind of created a little bit more drama about the injury than typical.
Yeah, it's interesting. I watched the game and they talked about giving him an injection prior to the game. The fracture, you could obviously see, I think he got hit a couple times, went down, and he was limping. It was a very significant limp at times. And as a quarterback, I don't know what leg that's on, but, he has to come up on that forefoot or that ball of that foot and put pressure on that little toe when he releases. I mean, you got to be going forward. So I wonder if that's going to impede his ability and his throwing accuracy. Just as curiosity, it's a mechanical thing, right?
Yeah, exactly. In fact, we've talked a little bit in the past about that whole kinetic chain, how, you're throwing, but you're involving all the parts of your body in that motion, every joint top to bottom, because you're relying on the ground to push off from, like you said, Shannon. And so, again, if he's having a hard time getting through the ground, that may affect accuracy and may affect his ability to kind of, drop the ball in where he wants it. And that's probably, I think, why he's probably seeing how he feels during the week to see if it's affecting that accuracy.
Yeah, but this team's playoff bound. They're looking good. He is a big part of the team. Obviously, he's going to play through this. I mean, he's not going to stop playing the rest of the season and be out. He's going to continue the season. Is that what you're thinking, with maybe a pin put in there but continuing to play?
Yeah, exactly. If they put a pin in, they'll probably make him a hard orthosis that sort of cups that side of the foot. And protects that area that they've immobilized with the pin, and have him continue to play and then take the pin out after a few weeks. So, yeah, I think he's a play regardless of which way he goes with the surgery.
Yeah. Gosh. Okay. He's a big part of the Packers. He is a big part of the Packers, no doubt. Another big person, a big running back for the Minnesota Vikings. This guy seems to be, I don't recall him not being injured this season. That's Dalvin Cook. He went out with a kind of a shoulder injury, it sounds like, and they're talking about day to day. I don't know if this is a re-aggravation or something new for him. What do you know about Dalvin Cook, running back, Minnesota Vikings?
Well, yeah, the interesting thing on him is this is actually he's had injury to the other shoulder, which is almost an identical problem, and he played through that. So I think that's why you're hearing the day-to-day issues. So he did dislocate his shoulder. They did an MRI on him that did show he does have a tear in his labrum. And I know in the past we've talked a little bit about how the labrum helps stabilize the ball on the socket. And so I think the reason they're saying day-to-day is his other side had a tear, never had surgery, and he has played through it, essentially just rehabbing it, keeping it strong, and essentially, probably hasn't had a recurrent episode of instability there. So my thought would be, I think their schedule is a little bit light. They are probably, looking at the playoffs, and I think there's a chance that he probably might get rested this week. But I think moving forward, it's just probably going to be maybe one or maybe 2 games that he'll be out while he just works on strengthening the muscles around the shoulder, make sure his flexibility is good, but then he'll return and not have surgery.
So you're predicting that he's going to sit at least this next week, this up and coming week, sit maybe 1 or 2 weeks, but he will play in the future. But if you've got him on your team, probably just assume he is going to sit this week with that recent injury and the discussion that you just described, the injury and the day-to-day discussion. So he's probably a sit this week, right?
Exactly. And for the fantasy football players out there, you look for Madison, who's his backup. Pick him up if he's available because he'll be getting the majority of the snaps. And when he's done that in the past, like you said, Shannon, Dalvin's been out on and off for things kind of recurrently. His backup has done quite well in fantasy. So their team is set up for whoever runs the ball to do pretty well.
Yeah, this guy, he's had a rough season. Hey, Detroit Lions, DeAndre Swift, second-year running back. Again, another shoulder, but they're describing it as a sprained shoulder. So, what does that mean? Happened in the second half. He's probably pretty sore, but probably not a significant injury to really have to sit him. But describe that sprain. When they say sprained from an orthopedic standpoint, what are they saying?
Yeah, here they're focusing on that acromioclavicular joint, or that area where the end of the collarbone attaches to the shoulder blade. And like you said, these are one of those things that's a painful injury when you sprain it. It's probably a grade 1 sprain, meaning none of the ligaments are torn, so the stability there is good. But it's essentially like a bad bruise where the bones come together. So any type of contact is very uncomfortable. 2 things that play into this. Their team is not doing well. He's probably their only, legitimate player right now. And there's obviously no playoffs in the future. He also is somebody that they had actually had him on some degree of like a snap count restriction just because he's been getting beat up a fair amount. So, originally they said AC sprain, he'll be back in a week, but I think already this week their coach came out and said he's still pretty sore. So I think he's a sit this week, and I think they're looking at the future. Let him get better. Let this not linger. They're not going anywhere for the season. So I think this is going to be a sit.
Yeah, sit. That's probably a really good call on your part. And what I'm thinking, for our listeners, although it's a minor sprain of the AC joint, you described that very nicely. But as a running back, if you get hit, you can't protect that joint. That joint there, you can't brace it. You can put a pad over it maybe. But if you get hit in the shoulder, that energy is going right into that AC joint. That is painful. And, so probably sit is probably a pretty good idea. Probably just sit this week and maybe a couple games, do you think?
Yeah, I think we're so close to the end of the season, unless there's some incentive for him to get some more yardage or something like that. I don't see why they would sort of risk him. So I think you have to pay attention to what they say week to week. But he's 100% going to be a sit this week, and I think it might go a couple games past that.
Yeah, here's another one that just I don't even remember this guy playing. The last time this guy played, Kristen McCaffrey, Carolina Panthers. Big part of their team, and he is re-aggravated an injury. He's got this terrible ankle injury going back about 6 weeks, it seems.
Yeah, and I think this is one of those situations where we've talked in the past about ankle sprains and, are they low? Are they high? How much do they involve? There's so many structures that help to stabilize your ankle. And almost every time, when you damage them, they'll heal, but you've got some degree of looseness or laxity there. And he is such a dynamic player. He's a very physical running back and in some respects kind of undersized for how physical he is.
Yeah.
And I think he's one of those guys that puts 1,000% through everything when he plays, and he plays so hard that, that's a bad sign. I think they're looking at same thing. They're looking to the future and saying it's not worth him coming back. And I think they put him on IR. So I think he's done for the season. No goals to try to get back, just to try to hopefully heal things up and be ready for next season.
Yeah, he's out for the season. I read somewhere where you're exactly right. They're putting him out. They're going to rest him and save him for next season. So he is out. If you have McCaffrey, probably not going to play the rest of the season. Here's another big name. Boy, there's been a lot of big names this last week. Darren Waller. This guy is the Raiders. He is a great tight end. And he hurt his knee Thanksgiving on the victory over Dallas Cowboys, which was a kind of an interesting game. And he's week to week, they say. What do you think?
Yeah, I think they took him out precaution-wise, and we're kind of concerned. Obviously he's a bell cow for them. He does a lot of their, he's a lot of their offensive punch. And the good news is when they did an MRI on him, it sounds like no major structural damage. So, ligaments are okay, no damage to the meniscus. They described it actually as a bruise of his iliotibial band. For the listeners who've heard that IT band, it's basically a strip of tissue that runs outside the knee joint on the lateral or the outside aspect of the knee, and it actually helps to kind of stabilize because it attaches to a muscle higher up in the thigh. And so, you use it a lot. You don't think about it a lot. You hear about runners are always stretching it a lot. So the good news is I think with treatment, with, good therapy, he's probably going to be a play, and he'll be back and able to contribute.
Yeah, and being a lateral side IT band, probably a contusion or a slight stretch. The IT band, like you said, is out there. It's an important aspect of the lateral function of the knee, but nothing that's going to keep him out. So he is a play, and I think that's a good call. He is important, so I think he will play. Another wide receiver here, or Deebo Samuel, San Francisco 49ers. Here's an injury that I think the listeners probably think is fairly benign, a groin injury, but it can be very functionally difficult to return for an athlete with a groin injury. Let's talk about Deebo Samuel.
Yeah, so the good news in his situation, groin injury is kind of a broad term. And so they sent him in, got him an MRI afterwards, and came out afterwards saying, hey, this looks like we'll have to treat it and he'll have to be out, but it doesn't sound like any type of surgery. So what that generally tells us is there wasn't an injury in the hip joint itself. So sometimes groin injuries can happen when you, say, tear your labrum in your hip. And for a high-level athlete nowadays, sometimes that's leaning towards surgery sometimes. So this was probably an injury to something called like your adductors, which are the heavy muscles on the inside part of the thigh that essentially stabilize the femur to the pelvic bone. And so, think of somebody doing the split and essentially stretching those muscles, like someone old like me who can't, doesn't move like that. If I do that, I'm going to be limping like a lame mule for a while.
You're going to be sitting. You're going to be sitting. Yeah,
exactly. So like you said, with him being a wide receiver, and they actually flex him into a running back position a lot. I think he's going to be a sit, and he may be a 2, 3, 4 game sit to get better for this. Yeah.
This is one of these injuries. Like I said, you look at it on paper, it's a groin injury, big deal. It's benign, right? This is one of these things that can linger if you don't take care of it. Get the tissue healed and ready to return, because you have to stop, start, and cut. And like you said, these people are moving in lateral directions all the time. So he's a sit probably at least 2 weeks, I think that's a good call. Hey, as we wrap up here, I just want to give a big shout out to you, Dr. Hawkins. I mean, last time we talked, I believe we talked about Jones, the running back for Green Bay. He had an MCL sprain. You said he would be back. He certainly came back, and even the announcers on the TV were just kind of astonished that he was doing so well with a light MCL sprain, and they got him back. So that was a good call on your part. Very accurate. Good work. So that's a wrap for us on our...
We try our best.
Yeah, you do great. Yeah, that's a wrap on our Start or Sit podcast. We look forward to talking to you next time. Have a great time.
All right, take care, everybody. Have a good day.